Leukemia is an oncological disease. Look at this picture, shows that normal red blood cells and leukemia red blood cells count in blood. MRI, spine, and X-ray. Detail going on. Introduction. Leukemia is a type of cancer that affects the blood and bone marrow. It involves the overproduction of abnormal white blood cells, which interfere with the body's ability to produce healthy blood cells. Definition. Leukemia is a cancer of the body's blood forming tissues, including the bone marrow and the lymphatic system. It typically starts in the bone marrow, where bone cells are produced. Types. 1. Acute lymphoblastic leukemia. Rapid progression affects lymphoid cells. 2. Acute myeloid leukemia. Rapid progression affects myeloid cells. 3. Chronic lymphocytic leukemia. Slow progression affects lymphoid cells. 4. Chronic myeloid leukemia CML. Slow progression affects myeloid cells. Causes. The exact cause of leukemia is not known, but several factors are believed to play a role. 1. Genetic mutations. 2. Environmental factors such as exposure to radiation or certain chemicals. 3. Previous cancer treatment. Risk factors. 1. Genetic predisposition. Example, Down syndrome. 2. Family history of leukemia. 3. Smoking. 4. Exposure to high levels of radiation. 5. Previous chemotherapy or radiation therapy. 6. Exposure to chemicals like benzoin. Complications. 1. Anemia. 2. Frequent infections. 3. Bleeding and bursting easily. 4. Enlargement of the liver or spleen. 5. Bone pain. 6. Central nervous system involvement. Pathophysiology. Leukemia starts with change in the DNA of the single bone marrow cell. This mutated cell grows and divides uncontrollably, leading to an accumulation of abnormal cells. These leukemia cells can crowd out healthy cells, impairing the body's ability to produce functional blood cells. Signs and symptoms: 1. Fatigue and weakness. 2. Fever and chillness. 3. Frequent infections. 4. Unexplained weight loss. 5. Swollen lymph nodes, liver or spleen. 6. Easy bleeding, bruising. 7. Petechia, small red spots on skin. 8. Bone pain and tenderness. Diagnosis: 1. Blood test. Complete blood count to check levels of white blood cells and red blood cells and platelets. 2. Bone marrow biopsy. Examination of bone marrow samples to identify leukemia cells. 3. Imaging tests: CT scan, MRI and X-ray to check for spread of leukemia. 4. Lumbar puncture to check for leukemia cells in the cerebrospinal fluid. Nursing diagnosis: 1. Risk for infection related to compromised immune system. 2. Fatigue related to decreased oxygen carrying capacity. 3. Risk for bleeding related to thrombocytopenia. 4. Acute pain related to bone marrow expansion and infiltration. 5. Anxiety related to diagnosis and treatment. Uncertainty. Management and treatment: 1. Chemotherapy, primary treatment to kill leukemia cells. 2. Radiation therapy, used in certain types or to prepare for a bone marrow transplant. 3. Targeted therapy, drug that specifically target abnormal cells. 4. Bone marrow transplant, replaces diseased bone marrow with healthy cells. 5. Supportive care, blood transfusions, antibiotics and medications to manage side effects. Psychosocial medicine: 1. Counseling for emotional support and coping strategies. 2. Support groups, connecting with others going through similar experiences. 4. Education, information about the disease and treatment to reduce anxiety. 5. Family support, involvement of family in the care process to provide holistic support. Prevention: there are no certain ways to prevent leukemia, but reducing exposure to risk factors like smoking and unnecessary radiation can lower the risk. Conclusion. Leukemia is a complex and serious disease with various forms and manifestations. Early diagnosis and appropriate treatment are critical for improving outcomes. Ongoing research and advancements in medical treatments continue to offer hope for better management and potential cures in the future. Thank you. Have a nice day.